Okay, so first thing I'm going to do is walk into the patient's room and say, good afternoon, Mr. Jones. My name is Cassie Myers. Today I'm going to be performing an routine central line care per unit protocol. And I'm looking at the hospital policies and procedures, and I understand everything. So I'm going to go ahead, put this down, and perform hand hygiene. And I'm going to look at your wristband and compare it to my chart. So Jaguar J. Jones is your full name, and Jaguar J. Jones is the full name on the chart. And then the date of birth is 8/25/1963, and 8/25/1963 is what I have here. And I see penicillin is listed as your only allergy on your wristband and the chart. And do you have any other allergies, Mr. Jones? No? Okay, that's great. Okay, so the next thing I'm going to do is raise the bed to a comfortable working height and lower the side rails and place the patient in a comfortable position with the head slightly raised. And next I'm going to gather all my supplies and my trash can and perform hand hygiene again. And now the first thing I'm going to do for the patient is assess the site. So I'm going to see that if I need a culture and whether or not I need to take a culture later on. And I'm also going to palpate the skin area as well for any signs and symptoms of complications, and I'll also assess for that later. So the first thing I'm going to do to begin the process is, well, I need to move this like lower. Okay, so I'm going to perform hand hygiene before I open my central line dressing tray. I'm going to open it. And I'm going to open one flap without crossing the plane of the tray and just go ahead and take out this mask. So I'm going to put on my mask and my goggles and also put on my patient's mask at this time as well. So my patient already has his mask on, and I'm going to take down my mask just for the video so you can understand me better. So my patient has his mask on already, and now what I'm going to do is put on clean gloves and go ahead and remove the dressing. So I'm going to secure the catheter device so it doesn't get dislodged during changing the dressing. So I'm going to go ahead and remove the dressing towards the site so that it doesn't become dislodged. I'm going to package this up and throw it away. And without touching the side of the catheter, I'm going to look at it for any signs and symptoms of complications and assess for edema, redness, swelling, infection, any drainage. And I'm also, at this time, I would take a culture if needed. So right now, I'm going to go ahead and begin changing the dressing. So I'm going to take off my clean gloves and open up and perform hand hygiene before I touch my sterile field. So now I'm going to touch the 1-inch border of my sterile field and open it away from me. Ooh, that's the 1-inch border, but that was not the flap. It was a fold. Okay. And then open this flap. Okay, so now I'm going to put on my sterile gloves. So I'm going to come over here, making sure you can see the gloves. Okay. All right. So yes, you can see those. Okay, so the sterile borders aren't touching, and I'm going to go ahead and pick up from the cuff, or the bottom of the cuff area. Oh, I missed my hand, so I'm going to just pick it up with my fingers, the right cuff. Okay, so this one went on well, so I'll just readjust. Oh, yeah. Okay. All right, so I'm going to move that so it doesn't accidentally touch it while I move this around. So now I'm going to move my supplies around in my sterile field. So the first thing I'm going to get is my alcohol swab. And when I rinse my patient's site, I'm going to, starting at the inward, going outward, move my swab around in circular motions. Making sure not to cover the same area twice. And getting that. So I haven't covered the same area twice, and I've started inward and gone outward in circular motions, and I'm going to throw that away. Next thing I'm going to do is wait 30 seconds for that to dry, but for the purpose of this video, I'm not going to. So I'm going to get my ChloraPrep pad and crack it, which I've already done in practice, and I'm going to secure the central line dressing change, so my left hand is contaminated, and I'm going to rub vigorously, first horizontally, and now vertically, all around the site in order to clean it. And while this is, okay, so I'm gonna take that. So now what I need, and my right hand is still not contaminated, I'm gonna reach inside my sterile field and grab my bio patch. So blue to the sky when I put it down. And I'm also gonna put the words up, or blue to the sky, so. All right. So, I'm gonna go ahead and secure that. And I've only touched the bio patch, and now I'm going to get the Tegaderm, so I'm just gonna get this. And since, even though my left hand is broken sterility, I'm not touching the Tegaderm with it, so it doesn't matter if I touch the borders. I'm only going to touch the the outside area with my left hand and the inside area with my right hand. So I'm going to make sure that the central line is over Tegaderm. With my right hand, go ahead and secure it. Okay, now I'm going to press it down and smooth it out for any wrinkles. And now I'm going to, with my right hand, take up the sticker. Well, that is the sticker for the date and time, so I'm going to go ahead and place that on my patient site and pick up the brown border. Okay. Oops, sorry, Mr. Jones. Well, I guess since the sterile process is over and I'm just taking out, oh, I guess I can touch the outside of it because, okay. With my left hand. Okay, so now I'm going to initial date and time the Tegaderm, and I'm going to clean up my sterile field, and I'm going to clean up my area as well. And then the next thing I'm going to do is position my patient for, well, let me take off my sterile gloves. So I'm going to position my patient for comfort and make sure the bed goes all the way down, the side rails are up, and then let them know the call light is within reach, and anything else that the patient needs is within reach. And then I'm going to perform hand hygiene, and then I'm going to document my patient's, how the patient tolerated it, what type of Tegaderm I applied, what type of drainage came out, the color characteristics, and the amount of drainage that came out, and then what type of cleaner I used on his catheter site and how the catheter was looking, and if I took any biopsy, what is the word? Culture, if I took a culture from it as well, and then date, time, and signature. And that's the end of my central line change.